control, and it has helped. And I know these persons are going to be ambassadors. They're going to be out there with their own experience, sharing with others, and as a consequence, we're going to have more persons participating in the program.
It's only just a phase. Once we're vaccinated, and everybody gon' be safe. Everybody gon' be safe. One kind, one people. We are roll up to roll up. Cause no man's alone. Do what's right. Cause I love you, brother, my sister. And we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah. It's better for us. Tell your mommy to roll out.
Bless up, Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.
It's only just a phase. Once we're vaccinated, and everybody gon' be safe. Everybody gon' be safe. One kind, one people. We are roll up to roll up. Cause no man's alone. Do what's right. Cause I love you, brother, my sister. And we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah. It's better for us. Tell your mommy to roll out.
Bless up, Dejo here, and I'm doing my part.
Is on.
Pleasant afternoon and welcome again to our National Emergency Operations Center COVID-19 press briefing for Wednesday, the 23rd of June, 2021. I am Lesroy Williams. Thank you very much for joining us for this press briefing as we continue to update you with what is happening in St. Kitts and Nevis in relation to the management of the COVID-19 pandemic. It is important that you pay attention to information that is official and information that is extremely important to how you manage yourself in the environment in which we are in at this present time. There is a serious anti-vaccination campaign going on. And one of the questions that you have to ask yourself is, what is the motive of it? The anti-vaccine campaign, vaccination campaign, they are using, of course, social media to propagate a lot of lies and misinformation and disinformation. And the question that you must ask, do these people have your best interests at heart? I always think of the Rotary Club, to which I think Dr. Wilkinson is a member, and they have a four-way test. They ask, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned? And when we read something and see something, the first thing that we must ask ourselves is it true? Not because it's in a book, not because it's in a newspaper, not because it's on the internet, not because it's on social media. You must ask yourself if it is true. And you must check your sources. Check your sources. Is it an authoritative source that is speaking? Where did this information come from? Is it from an official organization? And when people come to you and tell you all kinds of things, oh, the vaccines do not work, the vaccines are killing people, ask them, present me with the data. And in the absence of data, and in the absence of evidence, then what you're saying is basically of no worth to what you are saying to me. And when people come to you and tell you you must make this choice, and you must make that choice, well, every choice has a consequence. And so therefore, people must also tell you what the consequences of your choices are. Otherwise, they're not giving you the full information. And so therefore, these press briefings that we have are intended to bring you information so that you can be educated, more knowledgeable and informed in terms of the science and what is being said, the official research, and so on. Important. I want to first invite Superintendent Cromwell Henry, the law enforcement officer, to give us updates in terms of the regulations. Before he comes, I recognize among us the Honorable Akila Byron Nisbet, our Minister of Health. I also recognize the Honorable Wendy Phipps, the co-chair of the Disaster Mitigation Council. Thank you for always being here and offering your support. Minister of Health, I also recognize the Honorable.
Good afternoon, all. The coronavirus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. These particles range from large respiratory droplets to smaller aerosols. Current evidence suggests that the virus spreads mainly between people who are in close contact with each other, typically within 3 feet. A person can be infected when aerosols or droplets containing the virus are inhaled or come directly into contact with the eyes, nose, or mouth. The virus can also spread in poorly ventilated and/or crowded indoor settings where people tend to spend longer periods of time. This is because aerosols remain suspended in the air or travel farther than 3 feet. The current emergency powers regulation is intended to prevent the kind of contact among persons that could lead to infection. Regulation 7 specifically restricts the unnecessary movement of people. It provides as follows: every person shall remain confined to their place of residence, inclusive of your yard space, to avoid contact outside of their family. And it provides some opportunities when we can go out to access essential services like food, medicine, and banking services. We continue to see too many persons outside of their homes without the requisite authorization. This is one of the fuel for the number of new cases that we are seeing daily. Since my last presentation on Monday, the police have arrested 2 persons for breaches of the regulations, 1 for breaching the night curfew and 1 for hosting a private party without permission. 12 persons were issued with tickets for attending a private party and 5 for failing to wear masks in public. We prefer voluntary compliance with the regulations. However, the police are prepared to do our part to reduce the number of new infections by enforcing the law with respect to the wearing of masks, hosting or attending social activities without permission, and for breaching the night curfew and the shelter-in-place order. Again, these provisions are intended to protect us, so we ask for your full cooperation in this regard. In closing, I wish to highlight another temporary measure in the regulations that is intended to protect us. It is a temporary suspension of liquor licenses. This means that persons who operate bars and restaurants are required to cease the sale of liquor. Again, this is intended to restrict the gatherings at these establishments for socialization. As I mentioned at the beginning of my presentation, the virus spread mainly between people who are in close contact with each other. Hence, the regulation prohibits this type of contact, and we ask for your full cooperation for our own safety. Thank you.
Thank you very much, Superintendent Henry. I now invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Committee Situation Report for today.
Thank you, Mr. Williams, and good afternoon to everyone. This afternoon, as per usual, it's my task to share with you the HEOC situation report for today, Wednesday, June the 23rd. We have been trying to contain this present COVID-19 outbreak. Now, we first identified this outbreak on May 19th. So over this past 4-week period, a total of 351 COVID-19 cases have been added to the Federation's tally. Over this same period, 47 persons who have been diagnosed with COVID have since recovered. So to date, we have 47 recoveries within this 4-week period. As at right now, the cadre of case managers, they are monitoring 301 active cases, 301 active cases. At present, we have 7 individuals hospitalized on our COVID ward. And these, well, we have a cumulative total of 23 hospitalizations over this 4-week period. And there are 3 COVID-related deaths so far. Now, this slide shows the number of newly diagnosed cases per day. And so today we have added 19 positive cases, yesterday 12, and you can see the numbers as outlined on the bars on the graph. This just shows that when we look at the data on the cases that we've added over this 4-week period, majority of the cases fall within the age range 20 to 49 years. However, the age range extends from childhood to persons over 60 years of age. When you disaggregate the data, the male-female ratio is almost equal. So at present, or to date, meaning over the past, from last year, March to present, we have a total, and so our COVID-19 tally stands at 396 for the Federation, 15 cases reported in Nevis, and 381 cases St. Kitts. We have a total number of 92 persons recovering between last year to present, and as I said before, 301 active cases, 7 hospitalizations, and 3 COVID-19 related deaths so far. I want to utilize this opportunity or this forum to reach out to the family, the loved ones of those who have passed. We want to extend our deepest condolences to the family and loved ones of the deceased persons at this time. With respect to the outbreak at Her Majesty's Prison in St. Kitts and Nevis, we have identified a total of 39 positive inmates. They have been isolated, they are being monitored as we speak. We will continue to provide you additional detail as information becomes available. Now, with respect to this outbreak, we continue to employ the well-known public health interventions that have proven the test of time. So we have a robust contact tracing process which continues. We continue testing all cases, their contacts, and even targeted and random testing are being conducted. In terms of our COVID-19 vaccination program, we continue our rollout. This we started on February the 22nd, and it continues to date. And we continue in terms of the restriction of movement in an attempt to curtail or to help us to contain this outbreak and flatten the curve. In terms of contact tracing, our cadre of contact tracers, we've engaged over 2,100 individuals already. They have been placed in self-quarantine. To date, over 1,300 of these individuals have been released from self-quarantine, and we have almost 900 remaining in self-quarantine. In terms of testing, we continue operating our mobile units. We have 2 mobile units. We have individuals walking into the respiratory or the COVID side of our emergency room. We've also established a drive-through mobile testing unit at the back of the JNF General Hospital. And, across these four testing teams, we have conducted over 7,000, or we have processed over 7,400 samples over this 4-month period. And so we continue testing. And as I said before, testing of cases, testing of contacts. We also conduct targeted testing and random testing. Now, in terms of our vaccine rollout, we get a lot of questions about this tile, and I wanted to spend some time to explain it. Again, our target is the adults in our population. And so based on our last census, 33,037 individuals, these are the adults in our population, and that's the number of persons. These are the number of adults in our population as highlighted through data from our last census. And so that's our target population, 33,037. And so over this 4-month period, we have covered 67.9% of the 33,037 with the first dose. So 67.9% of the 33,037 individuals have been covered with the first dose, and 36% of the 33,037 individuals have been covered with the second dose, or they are fully vaccinated. Or even more specifically, that's 11,895 persons have been fully vaccinated. So as of yesterday, Tuesday, as of end of work day, yesterday, Tuesday, June the 22nd. Thank you for that. All right, and so the emphasis going forward is how can we live in the context of COVID-19? What are the protective behaviors we need to adopt to live and exist safely in the context of COVID-19? Now, in the Federation of St. Kitts and Nevis, we have an order, a shelter-in-place order. So really, you're only to move if movement is deemed essential. If you're an essential worker, or if you're going to the supermarket, the pharmacy, or you're going to access health care. Other than that, you are asked to shelter in place. We want you to wear your face mask at all times, sanitize your hands, and maintain that safe distance of 6 feet. When we look at the numbers, there are individuals who are expressing concern about the numbers that we report daily. And so when we analyze the numbers, when we look at the data gleaned through the contact tracing process, we realize that the issue or the problem is at an individual level. The contacts are still engaged with individuals who may be positive, and they are picking up the infection. So that tells us that individuals are still not in complete adherence to where these non-pharmaceutical measures. So individuals are still assuming that their friends, contacts, loved ones are virus-free, and so they may drop their guard, not wear their face mask, not sanitize after interaction with such individuals, and they may not be maintaining that safe distance. And so that's why most or majority of the recently announced cases, they are contacts of cases who have now become positive with COVID-19. So it tells us that they are not wearing their face masks, they are not sanitizing their hands, and they are not ensuring that safe distance between themselves and others. And so, ladies and gentlemen, going forward, we can get out of this outbreak if, as individuals, you and I adhere to these non-pharmaceutical measures. And so everybody is asking, what are we going to do? We need to start looking at us, yourself, ourselves. What am I going to do to help us to get out of this situation? And if we all we all have a part to play in terms of adhering to these measures. So what are these COVID-19 protective behaviors that we really need to adopt on a daily basis? It's important for us to keep on that face mask. If you're moving for work, if you're an essential worker, and if you're working in the grocery store, if you're working in the pharmacy, if you're working in the healthcare setting, if you're working in the bank, these are the entities that remain open. If you're working in the restaurant, where persons can order takeout, it's your role and responsibility to keep your face mask on, covering nose and mouth at all times. Yes? And so this is very, very important. Let us not assume that the individual you're interacting with is virus-free. Another protective behavior, hand washing, sanitizing your hands, especially after touching high-touch surfaces. The doorknobs you push open going into the pharmacy, the restaurant to collect your food, the bank, the countertops at the cashier, wherever you may be. These are high-touch surfaces. You must sanitize your hands after touching these surfaces. Hand washing is very critical at this point in time. And when you're going into the grocery store, there is a lady or there's a gentleman ready to sanitize your hands. But please remember, you need to sanitize your hands after you put away the trolley, after you would have, unpacked the groceries in your vehicle. And then when you get home, you need to sanitize your actual grocery items. You put them away and then wash your hands again. Very, very important, hand washing, especially at this point in time. Maintaining that safe distance, especially when visiting the older adults, when visiting the older adults with underlying comorbidities. For example, a grandma, a mother who is over 70, who has diabetes, hypertension, heart disease, asthma. Please maintain a safe distance of 6 feet or more from these individuals. Let's not assume that they are virus-free. Let us not assume that you and I are virus-free when interacting with these individuals. Protect them by remaining that safe distance away. So you take groceries, you take food, you make sure you sanitize same before you hand over, and then you maintain your distance, and then you leave. All right, maintain a safe distance from other patrons when you go to the supermarket, to the bank, or to the pharmacy. And maintain that safe distance when interacting with friends, relatives, and loved ones. A number of our recent cases are contacts of cases who are friends, relatives, and loved ones. So it's very, very important for us to adhere to these measures and start practicing these measures every day. And in so doing, you'll be protecting yourselves and your contacts from the virus. Remember, the vaccine is still available. We have vaccines available. The present batch expires on June 30. We want those who have come on board and have received the first dose. Remember to look on your card, and if remember your second appointment, come out to get your second dose of that vaccine well ahead of the expiry date, or well ahead of June 30. Thank you.
Thank you very much, Dr. Laws. I want to recognize the presence of the Attorney General, the Honorable Vincent Barron Jr., the Chair of the Disaster Mitigation Council. I would now like to invite Mr. Abdias Samuel, who is the Chair of the National COVID-19 Task Force and the National Disaster Coordinator at the National Emergency Management Agency, NEMA, to give us his presentation.
Mr. Williams, thank you, and good afternoon to everyone who is watching by various forms. Today I'm going to be reflective on what we have been doing for the past year. I'm also going to look at what we are doing as citizens, residents of this country during this crisis. I'm also going to touch on something very important, which is the misinformation that is happening, and equally so, I have to come to the defense of the team, meaning the members that sit on the National COVID-19 Task Force. As I reflect, when we first received the information in 2019 about COVID-19, the activation of the several subcommittees that make up our national disaster management framework, we began with a number of discussions with the CMO and also a key few persons within that framework. We developed a plan to respond to this particular challenge or threat that eventually would have reached our shores. Some persons that then thought that we were crazy, that's not going to happen here, it's not going to reach here. Some persons thought that we were overreacting in our preparedness measures. Eventually, the virus reached here. Many persons called wolf. The wolf reached, and we were able to deal with the wolf, hunt it, contain it, and we were able to keep a safe environment for our citizens and residents. Let us look at what we went through in 2020. On March 31st, we realized that we had to go into a lockdown. We issued travel advisories against a number of countries. On the 25th of March, the first 2 COVID cases were identified in St. Kitts and Nevis that created panic and havoc. On the 25th, we closed our borders to commercial flights. On the 31st again of March, we went into the 24 hours curfew lockdown. And from there on, we had partial curfews, and then we had to go through another 24-hour lockdown. Ladies and gentlemen, churches were closed. We saw the reopening of churches. On the 5th of June 2020, the country was guided through a safe election. 14 days after that election, that is when our tensions, our fears were allayed, because we received no outbreak from the safe hosting of elections. We said that in Suriname and many other countries, after they hosted many elections, many countries received outbreaks. St. Kitts had no outbreak. Then we got the repatriation flights. We saw the reopening of the education sector. We saw the reopening of the borders. And we were preparing you, we were coming here day by day, preparing you for what was to come once the borders open. Dr. Wilkinson said it, Dr. Laws would have been saying it, the Attorney General would have been saying it, the then Minister of Health would have been saying it. Once our borders open, it means that we are opening up ourselves to the virus coming back in. We went through a long period where we had absolutely no cases. We were proud citizens. We were happy. St. Kitts was on top of the world. St. Kitts was being recognized as one of the best models. But during that period, we continue to educate you that the virus is going to come back again. We ask you to prepare. We went through the process. Person said, what corona, let the corona come, open up the country, let it come. Nothing can happen. It's a hoax. Well, ladies and gentlemen, it's back. It has impacted our economy. It has impacted the lives of families where we have lost 3 citizens, and we have said 1 was too many for us to lose. We have lost 3. We have done our best. I want to pause to commend all the professionals, despite of what is happening. Dr. Wilkinson has come under many attacks, unnecessary attacks. A family man, a man who is serving his country, a man who is carrying a heavy load for this country, and we are attacking him personally and otherwise. That is not right. We have the CMO, who has come under attack, a lady who don't even speak, humble by nature, quiet in her every essence. And these professionals come under attack. And I have to defend as the chair, as the lead. I don't mind the attacks come on my person. When you're leading a team, you take responsibility. You have to be out there to protect your team. And I have to protect the team. I have to keep them solid. I have to keep them together. Otherwise, we're going to have challenges. There is no way that you should be attacking the messengers. They are providing us with a service of human service. I have never heard them in any meeting ask for an extra pay. We have the Commissioner of Police, the Commander of the Defense Force, the Commissioner in particular, who comes under heavy attack, personal attacks, and otherwise. And all I am asking for you, our dear citizens and residents, is to be able to take away the negativity and just stop. Take some time and say a little prayer for them. Every time we start a task force meeting, what we do is pray. We don't start a meeting without a prayer, because we need it, and we need it now more than ever. We also have permanent secretaries of Foreign Affairs, Ministry of Tourism, Ms. Kebas, Ms. Carlin Henry Morton. You also have Superintendent Henry. I have never seen someone so committed like Superintendent Henry, that 1 o'clock, 2 o'clock, 3 o'clock in the morning, 4 o'clock in the morning, 5 o'clock, and still midday, you have access to Superintendent Henry. He has to get up out of his bed at times and move with his men to get things under control. You have Superintendent Rogers, who patrols and patrols and patrols to ensure that persons are adhering to the protocols. We have Mr. De Silva, who goes above and beyond the call of duty to ensure that the compliance teams are doing their best to protect you while you sleep, protect you and ensure that your business, your place of work is safe. I also have to acknowledge the other members of the team. You have Ms. Raquel Brown, ferocious in ensuring that the tourism sector and the tourism product remains the best that it could remain in the region, in a very competitive market. You also have Dr. Judy Nisbet, Mr. Brian Dyer, Mr. Michael Manners, who travels from Nevis every Tuesday afternoon to be here to ensure that they share their expertise and ensure that they are part of the process in ensuring that they keep us safe. I also want to recognize Mr. Williams. So he's not only here moderating, but he sits and provides guidance when it comes to the media arm of the National COVID-19 Task Force. You have Ms. Lonely Archibald representing Customs. And these senior government officials are here every Tuesday afternoon as we deliberate and debate on how we are going to continue to protect the country and take the country out of this crisis. But equally so, we have the Attorney General, and in particular, the Honorable Wendy Phipps, who sits with us on a regular basis. And I have to pause and commend Minister Phipps. Sorry, AG. But Minister Phipps has to make an ultimate sacrifice, whereby she has to rush from here to go home to look after her mom, her bedridden mom. And these are personal sacrifices. So when individuals are using social media platforms to attack these very persons who are contributing to their country in order to keep us safe, ladies and gentlemen, it's rather sad. And I have to really stop today and speak and come to the defense of our team. They have been working hard. Not once have I heard that the medical professionals, security forces, other civil servants ask for $1 extra. Never. They have never complained about getting extra pay. They have never complained about getting nothing. We come here, we spend 3 to 4 hours deliberating. dealing with the science, dealing with the logistics, dealing with regulation. We have Mr. Rohan Walters, who is embedded from legal, who provides us with the legal advice as to the do's and don'ts. How will this impact regulation? Does it correlate with the Constitution? So we have a comprehensive team that come together. They come together every Tuesday afternoon and when necessary to ensure. We have Mr. Denzel James, who provides the guidance as to our ports. I remember being in Spain in 2012, 2013, and the general who was giving us the lesson in the military school in Spain, and I was in Madrid. He always says the key to any country is its ports. If you impact its ports, you're impacting everything for a country, one in particular like ours, who depends on importation and exportation. Ladies and gentlemen, today I didn't come with no prepared script because we are in a crisis. And during a crisis, sometimes we have to stand, and persons may not like it, but we have to bring the direct message. And the message is we need to get out the crisis. And we need everybody involved. This is not about the task force alone. This is not about the HEOC or the medical professionals. This is everybody. Superintendent Henry spoke about the persons who are breaking the curfews. I also heard that there was a party and a catamaran. And I am asking Superintendent Henry to investigate this situation. Because if this is so, we will be pursuing prosecution against these individuals. This must not be. There is no privilege for no one. The other day when I left here to go home the other day, I was stopped 4 times by the police. Buckley's, by the stop, and Monkey Hill, by the airport, and still beyond. And guess what? I had to turn back to Nemo to collect a document for the commissioner that he asked me to. They are doing their job, so there is no special privilege. The other day I was driving behind Minister Phipps. She was stopped as well. Twice. There is no special privilege. Whether you enter in the country, whether you're on land or sea, there is no special privilege. I'm hearing this rhetoric about persons entering the country and free to move about. I would like the evidence. And if you bring the evidence that someone entered this country without the proper control measures, I will officially step down right now as the chair of the National COVID-19 Task Force and tender that resignation. Nobody under the National COVID-19 Task Force watch has entered this country without any type of restrictive measures that are in place. None. We have created bubbles for special consideration, and we have been truthful and open with you with daily briefings, weekly briefings about what we are doing. Nothing has been hidden from the general public. And that was one of the first things I said to the team. Our business has to be the public's business. And the public must be embedded in everything that we do. Now we move on to the topic of the vaccine, who is vaxxed and who is not vaxxed. And this is a critical thing. We are in a crisis. The crisis as it is right now cannot be segmented. Yes, we want you who are vaccinated to feel proud, and we are proud of you for what you have stepped up to do. But we cannot compromise those that are not vaccinated. That's the reality. When we get out the crisis, when we bring back St. Kitts to that stage whereby we have no cases basically, or things are under control that we can work with whatever numbers or threshold that we have, then we can look at the restriction easing up of some of the restrictions. And we have best practices from Barbados, Grenada. We have looked at what the BVI is doing. We see Bahamas, what they're going to implement. We see what's happening in Jamaica. We see what St. Martin is doing. So we are looking at all the best practices globally. Look at Israel. Israel going through another a wave of COVID-19 cases, positive cases. So therefore, we are not doing bad at all. It took Barbados 6 months to bring the outbreak under control. It took Antigua over 6 months, almost to a year, to bring this under control. And we are poised to bring this particular crisis under control with your assistance in a shorter period than that. We are hoping to get that cruise ship arrive at our ports. We were preparing for it the other day. We were ready to have it come to St. Kitts and Nevis. And we are poised to have it back if you play your part. We are poised to have the taxi operators start to make their earning once you do your part. What about the persons working at the beach that stop me on a regular basis? They will do their part as well. So we are getting there. We are getting there. So I need your help. I want to commend those persons who call me 1 o'clock, 2 o'clock, 3 o'clock, 4 o'clock in the morning and provide us with the information of these persons who are having these private parties. And the police will continue to do their work. Those are responsible citizens. Those are responsible citizens, those who are providing the information. Yesterday, I must say to you, during the COVID-19 task force meeting, the matter of 311 was brought up for discussion. We heard your complaints, your concerns, and the permanent secretary, who also sits on the team, Ms. Dolores Stapleton Harris, she has advised that the Ministry of Health has already begun the enhancement of the efficiency and effectiveness of 311. So in the future, be more patient with them, provide them with the necessary information, and if you have a complaint, log the time period you made the call and call the authorities at 311. You have the minister, you have the permanent secretary, you have the CMO, you have the medical chief of staff. You also have access to calling us here at the task force level and lodge your complaint. Because we will not stand for anyone disrespecting anyone who is trying to help the national response efforts at this time. I want to continue with my presentation at this time. John, load me up there, please. Good. Now, how are we going to stop this spread? How are we going to stop this spread? It's been said, and we're going to continue to say it. And if you look at this slide from the CDC, it gives you some of the non-pharmaceutical measures. But here's what's more important for us. The next slide, please. Look at this graphic that you have here. Bobby and his dad are protected when they do what? They stay at home. Look at this slide. Bobby and his dad are protected when they stay at home. And what do? They stay 6 feet apart if they have to go outside. They wear their mask, they wash their hands, and they avoid crowd. And that is the consistent message that has been given to the general public. Consistent message. Nothing different what the United States is doing, nothing different than what Canada is doing, nothing different than what the Europeans are doing, nothing different that the Africans are doing. Same message. But here we have persons jumping over the fence and going over by the girlfriend, and the girlfriend positive. Here we have persons using government vehicles and the G, driving the Gs, going to pick up people here and there and take them here and there because they were quote-unquote labeled essential workers. And I have to commend the security forces. And that's why the officer said, Mr. Samuel, I have to stop you, because the G, persons are using the G vehicles to do things outside of the norm. So let's go back to the graphic. Bobby and his daddy are protected because they stay at home. And Bobby and mommy will be protected if they stay at home. Bobby and everybody will be protected if we just simply stay at home. It's just as basic as that. Stay at home. That's why we have the stay-at-home order. As the quicker you do this, the quicker we get ourselves out of this crisis. It's just simple as that. We cannot do it alone. It's not no task force. It's not no government alone. It's not no churches alone. It's not no police. It has to be everybody. Stay at home. Stay at home. Once we have that and we see the numbers trending downwards, it was good. The other day when the CMO said only 9, reported 9, I said, good. I went on Facebook and said, listen, we're breaking the chains. Let's stay together, SKN. Don't divide us. Unite us. I have to preach to them, Mr. Williams. I've been quiet, and I've been quiet long enough. Let's continue, John, with the slides, please. Here's where we go with the fake news. I see a number of things circulating on Facebook and social media, people sending to me. The first one, they send me one with Dr. Wilkinson. Next thing, they send me one with another, what it was, something or the other. I'm not going to give it much attention. They send me another one with this, about 5 to 6 things they send me over the past few days. Spreading fake news, you're spreading the virus. You're spreading fake news, you are spreading the virus. Don't engage these individuals. If you really want to join the national response efforts, don't engage. If you reply, share, or quote false information, even to attempt to correct or refute it, you are helping to spread. Block them. If you don't know the person who has shared that content, you should not engage them, but block them. Block them. We need to break the chain, not only of infection, but break the chain of fake news. Don't spread the virus. That's the hashtag with fake news. Let's break the chain of that as well. John, give me the next one. If you don't know the person and you feel comfortable doing so, you can send them a polite message telling them information is false and explaining why it might be dangerous. Seek official sources, and we have been saying that. You have SKNIS. You have media houses who are being responsible journalists, sharing the information. If we don't have the information, ask for it, and we will make sure that we provide you with that information. Because nobody under the task force, while I am the chair, will hide no information and provide no misinformation to the public. I prefer to not be there if anyone would exercise that. Our integrity, not mine alone, but our integrity means more. So no misinformation will come from our team. Next, continue, John, please. That's it for the misinformation. It's a serious virus. It's a serious virus. So I'm appealing to the general public to help us here. We have a few more days remaining, and we need these few days for everybody to come on board. I had a lady call me last night, Dr. Wilkinson. I think she's probably in her 60s, 70s. She said, Dr. Wilkinson ain't talking about giving me some money. That's what she said. Dr. Wilkinson ain't talking about that. She said she's not working. But let me just say to you, my friend, I listened to you for almost 25 minutes, and I can assure you that the government is looking into that particular situation. It's a comprehensive response. We have social services giving out care packages. If you need that assistance, please reach out to social services. If you're not working and you have social security, I don't know what social security. If not, please contact Ms. Shonell James, Labor Commissioner, for more guidance in that regard. Dr. Wilkinson ain't know nothing about industrial labor laws and engagement. That's for Minister Phipps and the Labor Department. So all of that has been discussed at the cabinet level. We go to cabinet every Monday or every other Monday to report to cabinet and have engaged the federal cabinet of ministers. And all of this is taken into consideration. So therefore, I'm hopeful that the cabinet will come up with something soon to assist you. But no other countries I have seen have come up with no stimulus for 14 days or 7 days or 5 days. If they do, it's something minimal. So we are looking at the best practices throughout the region, and we are hopeful that cabinet will come up with something for you. Now, we are now within the 2021 Atlantic hurricane season, and here are the names of the storm. And I'm asking individuals to continue to prepare. We have a tropical wave that is passing through the chain of islands, but is more threatening the Windward Islands as opposed to the leeward. My understanding in speaking to Mr. Elmo Boak, Senior Met Officer at the St. Kitts Met Services, who would have indicated that we may see some cloudiness and some slight showers, but the heavier showers will be experienced in the Windward Islands. Next slide, please. Dr. Wilkinson, why don't you come down now? So I won't come down now. So this is the forecast for St. Kitts and Nevis. So the synopsis of this, we have some shallow moisture and instability preceding and approaching tropical wave, which will maintain a moderate chance of showers across the region. So our seas will be 1 to 1.5 meters or 3 to 5 feet, and we should have winds gusting at approximately 12 to 18 miles per hour. So dear citizens and residents, I think I have reached out to you. The team, the National COVID-19 Task Force, will continue to serve the voices of every single sector of our society. We are not here neither for the rich nor for the poor. We are here for everyone. And we are here for the voices of everyone. If you don't agree with the messenger, just don't listen to the message. But understand that when we went to school and you don't listen to teacher, and it's time for exams and you fail, well, I know Miss Jacobs again, once you fail, Miss Jacobs used to give us our lashes. Or if we do anything, Miss Jacobs, you remember the lashes you used to give us once Mr. White sent us down to the class, down to the office. So if you don't pay attention, you don't want to listen to the messenger, it doesn't mean that you have to go all over and attack. So if it is that coming out to the aid and to the assistance of my colleagues means that you are going to attack me as I finish here right now, so be it. If you want to make me your target, so be it. But all I am asking for the general public is to support what is being done. Bring your advice. We welcome the all of society approach. So all I am asking you to come on board and support. We welcome everyone. Don't go around and target the people. It's not right. Mr. Williams have been targeted. All other members have been targeted. Superintendent Henry, for doing his job, has been targeted. It's not right. We are in a crisis. Let us get St. Kitts out of this crisis. And then we could have this further discussion. Thank you, Mr. Williams, and all the best for you.
Thank you, Mr. Samuel. You didn't have to mention me being targeted because I'm not easily distracted. But in media, there are two terms, misinformation and disinformation. While they have similarities, they are not the same thing. And misinformation is simply wrong information. Disinformation, on the other hand, is not just wrong information, erroneous information, but it's deliberately done with a malicious intent. So when Mr. Samuel said misinformation, what we are seeing more of is disinformation, because misinformation, somebody can be sincere with misinformation. It's just wrong information. But disinformation is pernicious. It is malicious. It is vicious. Intended to mislead, intended to create confusion, intended to create mayhem within the society. And surprisingly, some of the influencers in our society are involved in this. I need not name them because I think you know who they are. telling people you have the choice to take the vaccine or not. But you're not telling them the consequences of their choices. If you take it, there's a consequence. And if you don't take it, there's a consequence. Educate the people. We will always have people who are propagating fake news. That's one thing. But what is even more alarming is to have people believing it. We should be able to spot fake news from a distance away as an educated populace. We should be able to detect crap from the minute that we see it. But amazingly, we run with things. I know that we are more intelligent than that. I know we are more educated than that. I know that we are more literate than that. It's not about emotion. Reason must be given the fairest play. And in a number of these things, reason is not given the fairest play. Ulterior motives are at work. Influencers in our society telling people that they will not take the AstraZeneca vaccine because they have done their scientific analysis. What about all the top scientists in the world that have come together and done their analysis, their scientific analysis, and have not just made this analysis based on one person, but a collection of scientists, world scientists, working on vaccines and vaccines science, and have come up with these things. And one person says, I have done my analysis. I will not take the AstraZeneca vaccine, but yet they have not provided you with that analysis. We have come to this section for questions and answers. I will first ask these questions from WinFM at Devon Cornelius. Of the current cases of COVID-19, what is the number of people who've received first and second dose? CMO, make a note. How many of the COVID-19 related deaths were vaccinated? Dr. Wilkins, you will answer that one again. An ambulance was seen at HMP today. Can you explain why? With active cases on the rise, what arrangements are in place for our healthcare facilities and services system, emergency room, hospital staff, specialists, for example? What about quarantine and isolation sites?
Thank you very much, Lesroy. I will attempt to answer some of those questions and leave some of the others for the CMO. As regard to the vaccination status of the deceased, first of all, I want to again extend my deepest condolences to the family members and the friends and even the community from where the deceased came from. And to say, as I said before, that we would not be discussing the specifics of the deceased at this point in time. I understand that the country at some point in time would like more information as regards to the vaccination status, etc., of these persons, and in time we will provide that demographic and other detailed information. But with 3 cases and 3 recent deaths, so I don't even think that they have been buried as yet. I believe that we need to give the family a time to mourn and so I will not be responding to any specific questions as it relates to the 3 persons who passed away. I can tell you that I was in touch with some of these families. I know that they're going through quite a lot, and it will be very insensitive for us to be discussing those cases at this point in time. I want to say, however, how proud I am of the people of the Federation of St. Kitts and Nevis, because I've said right here before, given the facts, in a crisis, our people will do the right thing. And to date, that is as of this afternoon, we have 22,497 persons who have come forward and taken their first dose, bringing the percentage of the adult population who got 1 shot to 68.1%. And what this is telling us is that the adults in the room, they are listening and they are responding. And I'm pretty certain that if there was a vaccine that was available for persons below the age of 18, the children would have responded also. And so the people of the Federation of St. Kitts and Nevis deserve a round of applause. Also, to date, 12,285 persons are fully vaccinated, bringing the adults who are fully vaccinated to 37.2% of the population. And again, that is significant. And so what I want to ask the media houses to do is to help us to continue to push the message so that persons can understand that this is their best shot at fighting the virus. What's the...
Mr. Williams, I think I understood you were talking about the quarantine sites and isolation. We have identified several areas for quarantine and isolation. At present, we are in discussions with the proprietors of these areas, facilities, so that we can get full access. We have submitted a contract that we received from one of the facilities. It's in the Attorney General's chambers, where this contract is going to be discussed. And then hopefully by Monday, we are hoping to have access to this facility so that it could be used for isolating all those positive cases who are at home, and in particular those who are misbehaving and not staying in. So by Monday, we are going to be ready to get all these persons out of their homes and get them into a facility where we're going to have it under control. Thank you.
I think I did not answer the question with the ambulance at the prison. The ambulance goes out all the time to many different places. The entire country is aware that there is an outbreak in the prison, and we've been going there doing serial testing and monitoring patients. And so it should be no surprise to see the ambulance around town.
Dr. Wilkinson, I don't think you answered one of them. With active cases on the rise, what arrangements are in place? I don't know what arrangements. For our healthcare facilities and services system, emergency room, hospital staff, specialists, for example. I don't know what arrangements. Then maybe that is what.
I don't know exactly what the person is looking for, but we've said before that we have put things in place from the very onset. We divided our emergency room in two, where we have one section where persons who have flu-like illness or suspected of having COVID-19, they are separated from the rest of the general population coming to the emergency room for service. We said that we identified a ward, which is the private ward, where we would be looking after persons who are being treated for COVID-19. We also said that we would command more of the hospital if we needed to, if there was a need that arose. We have said here before too that almost 99% of our doctors are vaccinated and they have the appropriate PPEs when they're dealing with these persons. We said that we continue to see an increase in the number of the other allied staff moving forward and getting vaccinated. And there would come a point in time when the country as a whole, including healthcare professionals, will have to learn to live with COVID, because COVID-19 is not going to go away tomorrow or next month. And so living with COVID doesn't necessarily mean zero COVID, but making sure that we have the things in place to protect ourselves so that we can decrease our risk of getting infected. And so that is what we are doing, and we'll be moving forward with this. And this is how the country is going to open up also, making sure that every person adopt the COVID-19 appropriate behavior, and every person who should be vaccinated get vaccinated so we can move forward. I also want to address something that has been causing some misunderstanding. We said that you can go to reputable sites to get information. And so if you log on to any reputable site, you will see that after the first shot of the AstraZeneca vaccine, you have about a 76% effectiveness against severe disease and hospitalization. After the second shot, when you're fully vaccinated, you have about 84% effectiveness against severe disease and hospitalization, and also 100% in terms of your risk of dying from COVID-19. And this is what was shown when the clinical trials were done. Being fully vaccinated, though, doesn't mean that you can walk in front of a bus and not die because you're fully vaccinated and because they say that you have 100% protection against death. You also have to understand, too, that you can be fully vaccinated and get COVID, because we have said that, although your symptoms might be mild, but you may have asthma and you can develop status asthmaticus and still die, even though you were fully vaccinated. You can be fully vaccinated and get a mild case of COVID. You can also get a myocardial infarction or a heart attack if you had coronary artery disease, and you can die although you are fully vaccinated. You can be fully vaccinated and get a mild case of COVID. If you have diabetes and hypertension and uncontrolled hypertension, you could get a massive stroke and you can die. And so being fully vaccinated does not give you immunity over death. And so that is the point that people need to understand. But being fully vaccinated gives you the best fighting chance, because it can significantly decrease your risk from getting severe disease, from being hospitalized. And if you have no other comorbidities, it is your best chance of staying alive.
I don't think that anybody who is fully vaccinated would want to jump in front of a train. These two questions: a person who has recovered from COVID-19 and who hasn't been vaccinated, how long do they have to wait before they can be vaccinated? A person who has recovered from COVID-19 and who hasn't been vaccinated, how long do they have to wait? And the other part is there some level of natural immunity achieved once one recovers from COVID? And if so, is there any plan to add those numbers to the fully vaccinated number in order to move us closer to herd immunity?
Okay, so when one recovers from COVID-19, one develops some degree of natural immunity. But when these persons are followed over time, it is shown that the antibody response decreases significantly after 90 days. And after 90 days, if you are exposed, you can get reinfected again. Because of that, everyone who should be vaccinated, they're encouraged to be vaccinated, even if you got COVID. Now, the question is, when do you vaccinate persons after they have recovered? Once they have had their negative test and they have recovered, you actually can start the vaccination process, or you can wait as long as 90 days, since up to that point in time, they should be able to mount a significant response if they came into some contact with someone who had COVID-19 and got reinfected again. Now, as it relates to whether or not these persons can be counted as we move towards herd immunity, I don't think that we'll be able to count them, but they will actually add to some of the degree of protection. But the direct figures that we'll have as it relates to herd immunity are those through vaccination. But again, we have to understand that science is based on experiments, facts, reasoning, and sometimes it changes as you move along. And what I want to do is to move away from just speaking about herd immunity, because there are a lot of persons who seem to think that it's a threshold that we reach and then we go back to normal. And that's why I keep talking about a significant proportion of the population being vaccinated. And so even if we get to 70% of the population, for example, we know that 70% of our populations, they are adults. But if in time we got a vaccine here for children, we'll continue to vaccinate, because we need to continue vaccinating such that we get as many persons protected. And so don't look at this 70% as if we reach that and we throw up our arms and we celebrate Herd Immunity Day and we go back to normal. It's a continual process, and we need to continue making sure that we educate our persons, we continue to adapt the COVID-19 appropriate behavior, and we make sure that everyone who should be vaccinated. It's not just getting to 70% and stopping.
Thank you, Dr. Wilkinson. This next question is asking if the Oxford AstraZeneca vaccine is effective against the new strain of COVID-19. I suppose you have the Delta, and I think you have the, what you call it, the Gamma? And Kappa.
There is actually a report that came out on June 16th indicating that the AstraZeneca vaccine showed a 92% effectiveness against the Delta variant and an 86% effectiveness against the Alpha variant. And so we are happy that we have the AstraZeneca vaccine. As you heard, we have sent off our samples for genomic sequencing, and when we get those results back, we would get a fair idea as to whether or not we have a new variant here in the community. But until we get that, we need to continue making sure that persons get protected by getting the shot that's available to them, which is the AstraZeneca vaccine. And you heard that the 30th of this month is the last time we'll be vaccinating under this batch. I'm happy that persons are coming forward in terms of the number of persons who came back for their second dose. We've been recording 300 plus per day, and I want to see these numbers continue to rise. So anyone who had their first shot, your date for your second shot, once you had it before June 1st or 2nd, you should be due for your vaccine, and make sure you come in and get vaccinated.
There is something going around saying that there are two types of vaccine being administered in St. Kitts. What I mean, two types, the Oxford AstraZeneca, but there's one that is approved and one that is not approved. They're saying that one is from India and then there's one from South Korea, and they're making reference to some SKN Bioscience Company Limited. They've had a vaccination card with something, and if you look at the vaccination card, you spot crap right away. But anyway, Dr. Laws.
Very good question, Mr. Williams, but I want to, respond in saying that both are approved by the World Health Organization. And so the AstraZeneca Oxford vaccine produced by the Serum Institute of India has been approved by the World Health Organization, and so is the AstraZeneca Oxford vaccine produced by SK Bioscience, South Korea. Actually, the batch we received from SK Bioscience, South Korea, was actually accessed through the COVAX facility, which is the global facility through which countries, territories can access COVID-19 vaccines. So it was sent through us through the most official route. And so, yes, both batches of vaccine have been officially approved by the World Health Organization through its emergency use listing procedure.
Thank you, Dr. Laws. This next question, what is in relation to the new vaccine that the Ministry of Health is looking to procure, what is the efficacy? Does the Ministry of Health have the same confidence in the Johnson & Johnson vaccine and the other vaccines which they are trying to procure? And are the side effects different or the same from the Oxford AstraZeneca?
One of the things that I like to do is to stay focused. And we are using the Oxford AstraZeneca vaccine, and we are hoping to secure other doses of Oxford AstraZeneca vaccine so that we can continue our immunization program. And so the persons who, for example, today, yesterday, last week, who were coming forward for their first shot, we will try and secure other vaccines, Oxford AstraZeneca, so that you can get your second shot. And so the efficacy, all the information we gave you about the first and the second batch, it applies to the batches that we will be getting.
There is a stay-at-home order for the public sector government, to which is the largest employer and the private sector. Workers should remain at home unless deemed absolutely necessary, with the advice of the Cabinet Secretary. Why is it that many non-essential government offices are providing non-essential services, such as citizenship by investment, the Land Sales Department? How can we slow the spread of the virus when the government is not leading by example? Attorney General, and then there's a next question. Why is public works still being allowed to do construction when the workers clearly can't practice social distancing and it is impossible to work in that heat in a mask?
Thank you very much, Mr. Williams, and good afternoon to all our citizens who are following us at this briefing. The
regulations that have been issued since last year under the Emergency Powers Act indicate that government officers should remain at home where they can work from home, but in certain circumstances, the Cabinet Secretary can authorize that certain offices could function as it is. And this is done because government still has to provide critical services to our society. Clearly, people's salaries have to be paid. Clearly, there are other support services that could be deemed essential for the running of our society, our economy. Just today, I was approached to find out if the STEP office has been closed because a number of our citizens require that they need to get some form of compensation to the STEP services. And so there are critical and important services to be done. As far as the CIU is concerned, there are people around the world who constantly communicate with the CIU to be able to keep a very important sector of our economy and revenue had by government to continue. And so while most of those employees at the CIU can function from home, can function online, there will be a skeleton staff from time to time that would have to access that office, and it is quite appropriate for the government to so require that and for the Cabinet Secretary to offer that type of authorization. We take this COVID-19 very, very seriously. It's not a game. And it would be that where the government requires that services for all people be had, that we require our public servants to come and do their job. Earlier, you heard the chairman of the COVID-19 task force, Mr. Abdi Hassanian, speak to the senior public servants who work tirelessly 24/7 on your behalf. I don't have to speak any more glowingly about the work that is done by Dr. Hazel Laws and Dr. Wilkinson and the champions of the medical team. Public service is an honorable thing. It's service to the people, and it's not to be taken lightly by our citizens. So yes, there will be government offices that are open, that require to get the functions of government to work, to continue, and it is in the interests of our citizens. Thank you.
What is the data based on vaccination versus infection, and perhaps raw data or percentages can be given based on the data?
We've said before that we're going to give you the final data, but if you just want me to give you an overall picture where we are comparing the fully vaccinated and we put in the other persons who were either not vaccinated, received just one shot, received 2 shots, but not 2 weeks out, we will tell you that more than about 90% plus of the persons who were infected were in that bracket. and it's only a very small percentage, I think about 5 or 6 or 7%, who might have received 2 shots but had no symptoms at all. Okay, but we said, though, we will be giving you a more detailed analysis in due course. And so the evidence is bearing out that if you are fully vaccinated, you are protected. We have said before that if you are fully vaccinated, your risk of getting infected and transmitting the virus is significantly decreased. But it doesn't mean that a fully vaccinated person may not get infected. But if you got infected and you're fully vaccinated, the chances are you would not have severe disease, you would not be hospitalized, and you would not die.
This question is for Dr. Laws. Why are we not showing the pending number of tests? I guess they're looking for the number of outstanding tests to correlate with the potential number of cases.
Very good question, Mr. Williams. We are in the middle of an outbreak. We are testing at 1, 2. We have 2 mobile units. We have tests being done in the emergency room and the drive-through unit. We have a number of labs processing tests. And so, Mr. Williams, because of the surge in cases and the innumerable samples being processed, we opted not to highlight because it's hard to tally everything, all at once. But we could attempt to do so, to provide that information. Thank you.
And this is our last question for the day, and it goes to Mr. Samuel. Mr. Samuel, you created a whole slide of utter emptiness. But you are not being transparent about the monies you are collecting for a specific quarantine site and also the security company.
Mr. Williams, I want to thank that individual for paying attention to what I said and being able to bring this to our attention. First and foremost, Mr. Williams would have gave a clear definition of misinformation and disinformation. 1, Abdia Samuel collects no money on behalf of the government or anybody else. The only thing I collect is my mere salary at the end of the month. Secondly, government only has responsibility for one site, and that is the OTI, the Ocean Terrace Inn. So what happens when an individual is going to stay at the Ocean Terrace Inn? 1, when he comes in, they make the reservation, they get the confirmation, they get a booking number that they will fill the KNA travel form with. From that, it assures us that they have somewhere to go. When they arrive here, I think it's about on the if they are 14 days, maybe they're 10, 11 or so, they actually are called by the person who is responsible to collect the monies, and that is Mr. Jusan Gordon, which you all may have grown to know and love. Mr. Gordon is the person responsible for collecting these funds, and these funds go to the Treasury. At the Treasury, I think they have an accounting department, and this accounting department manages this. Let me just say to you, whoever the person who asked the question, we don't have a security company there. What we have there is what you call compliance officers and members of the security forces who are paid their regular monthly salaries to do their job. So at the end of the day, we don't collect monies, or Abdias don't collect the monies. Monies are paid into the Treasury that is collected, and then that is what is used to pay OTI $500 according to the contract for the use of every room. So every time a room is occupied, we have to pay $500 to the TDC for the OTI, the use of OTI. That is also separate and apart from one, the electricity bill that has to be paid, and that has to be paid by the government. 2, the water bill that has to be paid by the government. 3, internet bill that has to be paid by the government. 4, the cable bill that has to be paid by the government. So for your information, I have just given you a clear outline, and if you want any further breakdown, you can visit the audit department at the Treasury, who will provide you with any further information, because I myself don't know how much is collected, whether 9 days, 14 days. All I know, monies are collected, and government has to add to what is collected to continue to pay the maintenance and everything else. For example, every time a cleaner cleans, we have to find money to clean that. Every time a positive case is moved, we have to hire a specialist to come in and clean those rooms. We also have to look at the linens. All of that is part of the responsibility of the government according to the contract that is there from TDC. So there you have it. That is how the TDC, the OTI, which is controlled by government, is managed. Oh, by the way, the others are collected by the hotels. For example, if you're going to go stay at Koi, you have to make the reservation with Koi. If you're staying at Marriott, you make a reservation with Marriott. If you're staying at Park Hyatt, you make a reservation with Park Hyatt. Four Seasons and everybody else. You have to make reservation with them. We don't see anything. We don't collect any monies or know what monies they collect. We don't impose on them what money they should charge for the quarantine period. So that is done by the hotels themselves. What we try to do, I can tell you, is try to influence them to give us local rates for nationals, because even me, if I have to travel, the government is not going to pay for my quarantine. I have to pay my own quarantine. So I would like to be able to afford it. So we have been negotiating with the hoteliers, and I want to, at this time, thank Koi Hotel for actually taking all the persons that would have been staying at OTI. They are now honoring all the reservations at Koi. So thank to Ms. Mara Gums and the team at Koi for assisting us. I also want to thank Royal Sinkits for supporting us as well. So with that said, that is how the process works. Thank you.
I will now invite the Honorable Keila Byron Nisbet, Minister of Health, to make some remarks.
A pleasant good evening to everyone listening and viewing. First of all, let me start by extending sincere condolences to the family members and loved ones for those persons we have lost this past week. I know it can be difficult and challenging at this time, but continue to trust that God has it all in His hands and continue to just lean on Him for strength at this time. For those persons who have tested positive and are in quarantine, some in the hospital, we continue to hold you in our prayers. We know it's very difficult. COVID-19 is not an easy walk-over type of disease. For some persons, it's difficulty breathing. It's pain just to take one breath. For some persons, all of their muscles, everything hurts. And so it's a lot to deal with. Not being able to be with loved ones and friends, not having the opportunity to have persons to come and visit while you're at your lowest. But you have to be able to be strong so that you can get healthy and you can overcome the coronavirus. And so at this time, I just want to continue to make a plea to everyone. Please, we are doing what we are doing for you. And we need your help as well in this fight. It's not just about a group of people sitting behind a desk somewhere making decisions. It's about thinking about how can we best protect you. Our staff in the Ministry of Health continues to work extremely hard with contact tracing, with testing. Our nurses are following up with positive cases to make sure that they're staying healthy for us to continue to do what we can do, but we also need your help. We need you to do your part as well in this fight. We need you to continue to follow all of the guidelines and protocols that are presented to you. We need you to continue to wear your face masks, social distance, keep your hands sanitized. We need you, if you have a business, to make sure you're checking on not just the persons coming in to access services, but also on your employees to make sure they too are healthy and they are well when coming into work, or even when at work, somehow just keeping a check on persons. We need you to make sure you're sanitizing high-touch surfaces. We need your help. We need you to stay home if you're not accessing essential services. We need you. And so I'm just making an appeal to everyone. We hear the numbers presented every day. We have gone from 45 to over 300 cases in this short period of time. I want to remind you, the virus cannot move alone. The virus depends on us as humans to move in order for it to move. In order for those numbers to keep rising, we are the ones that have to move in order for the virus to move. And so I'm making a strong appeal to everyone. Let us think about our family and loved ones and keeping them safe. It's not just about us as individuals, but it's about a whole group. Our family, loved ones, community, the children who can't be vaccinated, the elderly who can't be vaccinated. We have to think about the collective whole as we continue to fight this good fight. But I am hopeful and I am positive that eventually and soon enough, we will get out of this. We will get through this. I see it in the vaccination numbers. We continue to see people turning out to be vaccinated. And as a government, we will make every effort to make sure vaccines are available when you need your second dose in particular. And we want to encourage you to continue to come forward, step forward, and be vaccinated, because it's about saving lives. As the doctors keep saying, once we have enough persons vaccinated, once we as humans begin to move, which means the virus will move, when it comes across someone who's fully vaccinated, there's more chance that it would stop right there with the fully vaccinated. So we want you to do your part. And so that's why I am hopeful, because I'm seeing quite a number of persons turning out daily to be vaccinated. I'm seeing more persons who are following the protocol and taking heed and understanding the importance of wearing your mask, washing your hands, social distances. I know how much and how important it is for us to be able to embrace each other, because that's our culture. But right now, the best thing you can do for your loved ones is to just keep that distance for now. We will have an opportunity, and that time will come again when we will be able to embrace each other again. But right now is not the time for that, because right now we're just trying to be able to keep everyone safe. And it's all of us continuing to work together is how we will get it done. And so I want to thank you all in advance for doing your part, so that hopefully when we get out of this, everyone remembers it's still a pandemic out there. The entire world is still in a pandemic. And so we have to keep all of our guards up. We have to remember to follow these protocols. We are hoping and praying for changed behavior once we get out of the crisis that we are in now. We do not know yet the variant that we're dealing with, but we know for sure we'll be able to overcome this, and somehow we have to begin to learn, how do we live with COVID-19 going forward, because it's not going anywhere anytime soon. And so keep in the back of your minds that even though we are going through this right now, there is a way for us to get back to normal, and it is a way for us, even if we have another outbreak, to remain as normal as we possibly can. And that is through 1, vaccination, 2, wearing our face mask, 3, keeping our hands clean, even if you have to walk with a small soap and a small bottle of water in your bags or on you wherever you go, and 4, social distancing. And so I just came here just to bring it all back into focus, because I want everybody to remember what we're doing here. We are all in a fight to keep COVID at bay, to get our curve back down to where we once was. But we need everyone to be willing to be a part of that fight. I can say that for the workers within health who are going nonstop. Some of them, our testers in particular, they're up at 4 a.m. at mornings, and sometimes they don't get done until 9 and 10 at night, all in an effort to make sure that we identify those positive cases and keep those positive cases from re-entering the community and spreading COVID-19. So we're doing what we can do. We're doing all we can do with the resources that we have. And so we just need you now to help us on this fight. And so I'm thanking you in advance for taking up that charge and working along with us. And to everyone out there who continues to play a role in trying to influence 1, 2, 3 persons, thank you in your efforts as well, because it is noticed and it is appreciated. And so that's why I just came back, just to remind us and to refocus everyone again. This is a fight against COVID-19. This is a fight the entire country have to take on against COVID-19. So let's continue to do it together. Let's continue to follow the regulations that are laid out before us. Don't give the police a hard time. Cromwell don't like it when health call him all types of hours asking him to collect someone because they've broken quarantine. It's difficult sometimes. And so we just need your help. And we're asking for that. And we will be able to get through it together as long as we all understand that our fight right now is against COVID-19. Nothing else. It's St. Kitts and Nevis, all of us, against COVID-19. So everyone have a blessed night, and please remember and keep that in mind as we continue to fight that good fight against COVID-19. Thank you.
Thank you, Honorable Minister. I think we needed those inspirational and motivational words that you just delivered, especially at this present time in the outbreak, the crisis that we are in. That brings us to the end of this press briefing for today. I want to thank all the persons who submitted their questions and who have continued to show a keen interest in these press briefings so that they can be updated with information and know how to manage their lives in the midst of the COVID-19 pandemic. I want to thank Mrs. Christmas Jacobs for her continued service of sign language. I thank our Superintendent of Police, the Cromwell Henry, the law enforcement man. We thank our Chief Medical Officer. We thank Dr. Cameron Wilkinson. We thank our Minister of Health, the Honorable Akila Byron Nisbet. We thank the Honorable Wendy Phipps, the co-chair of the Disaster Mitigation Council, the Honorable Vincent Byron Jr., the chair of the Disaster Mitigation Council. We thank Dr. Marissa Carty, who works very hard in terms of putting all these stats together and the reports that we receive, the situation reports, and so on. She's basically the one that does all of that graphic and so on, working very hard, but yet very quiet behind the scenes. We thank her. We thank ZIZ, AJ, and John James, and all who work at ZIZ, and the entire media, Win FM, Freedom FM. We thank Von Radio. We thank all the media houses in the Federation, all the newspapers, the Labour spokesman, the Democrat. We thank all the media because we need your support in this bio-warfare, in this fight that we're in against the COVID-19 pandemic. We want to reduce the misinformation and the disinformation, and you have to help us. You, the media, have to help us in doing that. So thank you very much. We will be back here at some other point. Until then, take good care. And as Jamdown would say, remember to wash all your hands and do not cough in nobody's face. Take good care. I am Lesroy Williams.
It's only just a phase. Once we're vaccinated, and everybody gonna be safe. Everybody gonna be safe. One kind, yeah. One people. We are roll up to roll up, yeah. 'Cause no man's alone. Do what's right, alright. 'Cause I love you, brother, my sister. And we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah, yeah. It's better for us. Tell your mommy to let it roll out.
Bless up. Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.